you can lose weight with these drugs, and you definitely will most of the time if you don't overwhelm them and try to find a sneaky way. Even patients who have bariatric surgery can gain weight if they drink enough milkshakes. And so you'll definitely lose weight under most circumstances. And yes, there are risks associated with this. And specifically, we know that there's some risks of thyroid cancer and some other things. But the bigger risk that we're concerned about is these risks of you've lost your muscle mass, because a lot of times patients will they'll get away from eating so much processed food to eating just less of it. Or they don't actually change the quality of the food that they're eating. And so they might just eat a little bit less because they still have a taste for it, but just not to the same degree. And they're not binging as much as they were. And a lot of times I find that processed food, if they've never learned how to eat right in the first place, they end up with sarcopenic wasting. And that's what we call Ozempic butt or Ozempic face, or, all the pejoratives that people have come up with when people have lost their muscle mass. So unless you train them to eat right in the first place and fix their neuroinflammation, because a lot of them will still be eating a ton of vegetable oil, and that vegetable oil is a potent neuroinflammatory agent, the omega-6. Unless you fix that, when they come off, their brain is primed, and now they can't drink 6 drinks anymore because they've gone down, but they've come off, and now their cravings are worse, and all of a sudden they start binging even more. And now they're going to rapidly increase their use. And so I've seen that. And so what we do is we fix their underlying metabolic inflammation so that their brain has healthy fats in it, and they have good coping mechanisms, and fix and work with them on their loneliness issues, integration into society, so that we don't fall back into the same pit. This drug is about $800 a month, $800 to $1,000 a month. Insulin is about $800 to $1,000 a month. And so the thing is that you're substituting one drug for another, and they're both $800 to $1,000 a month. And if you come off of either one, you could have complications if you do it wrong. And so what we really want to do is make sure that we've provided the infrastructure support to get that patient and have them recognize that this is a harm reduction method rather than a permanent lifestyle. I don't want to see these patients on this drug for year after year after year. What I want to do is I want to give them a good kickstart in the right direction, and then have them fix their metabolism and their brain, and then use that to long-term get this. So I think that they have value as in terms of harm reduction, as long as we've done the coaching. It's the one, and so it takes vigorous coaching. And I look at this as, this is not something coaching from a distance. Oh, I'm going to talk to that patient once a month or once every 3 months. If you're doing that in this patient population, you're doing a disservice. It takes, on average, for cigarette smoke, it takes 14 attempts to quit before you can actually quit. For carbohydrates, it's probably more. And so you have to have reinforcement and support, and you have to have other people with you, and recognize that you're creating and breaking habits, and you're creating support, and you have to change their perspective of where they're headed. And so I spend a lot of time talking about future, trying to ask patients, well, okay, so we helped you, how are you going to help the people around you? And what we want to do is we want to recharacterize life for them, as it's not about them individually, it's about how are they going to carry the information that they learn to their peers, to their church group, to other people. And it's that future orientation that changes the present. Everybody, once they realize that they can do it, wants to share that information, but they might be afraid to, because they've historically been very lonely and isolated. And so that's what we try to work with, is to find ways to connect people. I have patients that were formerly in wheelchairs because they weighed 450, 500 pounds, and they couldn't get out of their house. And yet they were still massively overweight. And we finally get them to the point where now they can go and participate in church and they're walking. I've got a gal that, was like that, and she's won poetry contests, and she's a spoken word poet. It's about that interaction. I've come to clinic and found my front lobby filled with people. It almost looks like a church revival. And I've mentioned church a couple times because in the community that I'm working in, church is a very strong driving force for people seeking shelter from the violence that's in the community. Church is one of the few sentinel lights, beacons of hope for them. And so we've aligned ourselves wherever we can with whatever beacon of hope we can get for our patients.